Pancoast tumor. Pancoast tumor is also known as superior sulcus tumor because it affects apex of the lung. So if this is the lung and if this is the lung, so it affects this apex of the lung. And the most common tumor is non-small cell lung carcinoma. This is the most common tumor in the Pancoast tumor. Okay. If this tumor grows, so either it will compress the nearby structures or it will invade the nearby structures, and this will cause the Pancoast syndrome. Collection of sign and symptoms. So let's suppose if the nearby structure is the recurrent laryngeal nerve, so the patient will be having hoarseness. If it affects the stellate ganglion, so the patient will be having ipsilateral Horner syndrome. And Horner syndrome is characterized by ptosis, meiosis, and anhydrosis, and they will be on the same side. If it obstructs the superior vena cava, so it will cause superior vena cava syndrome, and all features will be bilateral because of the edema on both sides of the patient. There will be blenching in superior vena cava syndrome, and the reason for blenching is that there is capillary refill. Okay, because superior vena cava is a vein, and this superior vena cava syndrome is a venous pathology. If the patient brachiocephalic vein is obstructed, so it will cause brachiocephalic syndrome, and this will be unilateral, one-sided, either right or left. But here there will be both-sided, both right and left. Okay. If this Pancoast tumor affects the brachial plexus, and most commonly the C8 or T1, so it will cause shoulder pain and sensory motor deficits. Sensory motor deficits, especially atrophy of the atrophy of intrinsic muscles of the hand. Intrinsic muscle of the hand will occur. Okay, and it will cause claw hand, also known as Klumpsky paralysis. Okay, if this Pancoast tumor affect the Phrenic nerve, so then there will be hemi-diaphragm paralysis, and on chest X-ray there will be hemi-diaphragm elevation, and the hemi-diaphragm elevation will be on which side? So this hemi-diaphragm elevation will be on the same side of the paralysis. This is because this is the diaphragm and it is innervated by the Phrenic nerve, which come from the C3 to C5. So this right-sided Phrenic nerve is lost. The muscle tone in this right side of the diaphragm will be lost. So it will be unable to contract. So when it is unable to contract, so it will be elevated. And this elevation is mainly because of the intra-abdominal pressure. And it cannot resist this pressure, so it will be elevated on the side, this is intact. Diaphragm is intact, and the tone is preserved. So it will resist this pressure, and the diaphragm will remain in its place. Hence, the Pancoast tumor arises in the apex of the lung, and it compresses the nearby structures, which we have already discussed, and the sign and symptoms occurs according to its compression or invasion of the nearby structures.